President Trump and Republicans in Congress are heading down a path to sweeping changes in health care. As promised, they're repealing the Affordable Care Act, otherwise known as Obamacare. But many believe the eventual replacement could also mean a dramatic cutback in federal support for Medicaid. With some thoughts on what this could mean locally is a longtime leader in community health, currently the president and CEO of the South End Community Health Center, Bill Walczak. Thank you very much for being with us, Bill.
Great to be here, Chris.
First of all, so talk about how things were back in the old days. I guess, when the health centers were just getting started. And of course, you were one of the founders of the Common Square back in the 1970s.
Yeah. Well, I mean, the reason why health centers were started was because the market did not take care of low-income people. So, we had access to medical care by middle-class people that could afford to pay, but low-income people were relegated to going to emergency rooms of health centers, of hospitals rather, to get basic care. I mean, I remember in the early 70s, we'd be looking at data from both Boston City Hospital and the Carney Hospital, talking about all these people that were coming there for prenatal care or for immunizations for the children in order to get into school. And that's just bad health care. It's awful health care. So the health centers really were started as a way of providing primary care, which is, in addition to being better care, is actually low cost, has a lower costing way of providing medical care, because you have somebody who's going to care for you, who's going to make sure that you only get the services that you need, and you're not going to use the emergency rooms as much because and the emergency rooms are very expensive ways of providing care.
And of course, one of the things the health centers are there for is that people in the neighborhoods have a lot of chronic health problems. And we talk about childhood asthma and how a robust health center makes a difference.
Well, the robust health center is open for walk-in care or urgent care services, is open 7 days a week. And so when a parent has a child who starts having the cough, the asthma cough, or has difficulty breathing, in the old days especially, but even today, people would rush them to the emergency room of a hospital where they'd get some kind of prednisone or something in order to allow the child to breathe better. That's not necessary in most cases. In most cases, you go to your primary care doctor, or you can learn the things to do in the event that happens. That happens in a well-designed healthcare system, and a well-designed healthcare system is all about primary care, making sure that people have access to primary care and that the primary care system is teaching people how to live healthy lives.
If you look at the big picture, at least, is there any sign that all of this sort of primary and preventative care has made a difference, either in terms of health outcomes or how much it costs to take care of people?
Well, just give you a really good example. In the early days of the Common Square Health Center, the infant mortality rate in Dorchester and Roxbury was so high. It was about 26.4 per thousand births, which is a third world rate. That's what you find in countries that have no healthcare system whatsoever. Curiously, one of the highest rates was in the housing project immediately next to Harvard Medical School. But that was in the 1970s and early 80s. And in fact, the Boston Globe started calling those neighborhoods the death zone of Boston, the death zone. And so here we are in Boston, the medical mecca, to use a term that has been used before. And we have this enormous infant mortality rate. Infant mortality rate has gone down like this. And the reason why it's gone down like that is because of access to good quality primary care, prenatal services, and the kind of follow-up services that's available through a well-constructed primary care system. We're now down actually below 10 in most neighborhoods of Boston. So this is an enormous decrease in that particular part of it. The other thing is just making sure the kids get their immunizations. Almost all children right now are covered in insurance because of Romney Care / Obamacare. Taking that away would be a disaster, because we'd be back in the days where 600,000 Massachusetts residents had no health insurance coverage, and therefore were reluctant to use the healthcare system. Reluctance to use the healthcare system produces more morbidity and disease. It causes more problems and costs the system a lot more money.
This is BNN News. We're talking with Bill Walczak from the South End Community Health Center. Bill, what about if we roll back the clock from today to what it was even before Romney Care? And it basically is that, Medicaid is for the poor people, and the rest of us, you pay for it yourself, or you get an employer-sponsored plan.
Well, it's an uncivilized way of approaching your own population, of telling people to basically drop dead if if you're in a difficult situation, you can't afford to be there. Or the alternative, which is the way most of America actually still operates, which is that you declare bankruptcy because of your medical care, because of your need for medical care that you can't afford. Healthcare in America is very, very expensive, and it is through the expansion of insurance. I mean, I'm a single payer advocate, first of all. I would much prefer that system that operates in most of the world, but in America it seems difficult to get that through. So the alternative is to try to get insurance an insurance product to every single person in America. Without that, you wind up with people not getting preventive care, not getting the kind of care that they need, not following up on a persistent cough that doesn't go away, that could turn into lung cancer and cost hundreds of thousands of dollars to treat, let alone cause such difficulty in lives and bankruptcy. So what happens without any kind of structure that we have gotten used to in the past 10 to 20 years, in Massachusetts for the past 30 years, but in the rest of the country really since Obamacare came in, is you wind up with a lack of a system, so that people wait until it's too late to get their care, and then it's much more difficult, much more complicated, and much more costly.
Well, one thing that we saw during Obama's 8 years is all these new health center facilities. They're bigger, and I think there's probably more capacity, especially in terms of urgent care. Even if you somewhat roll back federal support for healthcare, what's going to happen to the ability to keep that expansion going?
That's difficult to contemplate. Massachusetts and most of the cities in Massachusetts and some rural areas of Massachusetts have had access to community health centers, which means that they have access to primary care, and that the primary care is quite good because Massachusetts is a civilized state which has provided enough dollars to be able to sustain those systems. So it's not a Medicaid mill, it's actually a very well constructed system with all sorts of continuity of care and services that are necessary. You roll back that, and what you wind up with is these impoverished centers, or centers that wind up going out of business and therefore less access. If we wind up with that kind of system, you're going to see us seeing our morbidity rates, our mortality rates, our disease rates going up again, just like they were in the past. There's no secret to how you create a healthier population. It's access to the kind of care that's necessary. It's teaching people about how to live healthy lives. It's giving incentives to people. It's taking away barriers to being able to get primary care. And with the kind of destruction that I see potentially coming out of the Trump administration, we could roll back in time to the 1950s when poor people had a lifespan in the 50s and 60s.
You know, there's one byproduct of all this growth in health centers and it seems to me, is that what this means is a sort of a cross-section of the community. You're not just sucking in the poor people who can't go anywhere else, but you've got other people in the mix as well, and that's a whole neighborhood culture, really.
Yes, I mean, you look at Boston in particular, which has a very robust system of community health centers. They're large, they're great employers, they give people access to their first jobs coming out of high school in many cases. But beyond that, they're also places where people have gotten confident because, you know, in the early days, you'd have doctors who would wind up leaving after 2 years, and then you wind up with new doctors and new doctors and new doctors. The health centers have gotten so sophisticated that now they're able to hold on to physicians. They have excellent physicians who are interested in the medicine of medical care rather than the business of medical care. And so there's no incentive to produce more tests than necessary, so it's cheaper in the long run, but also they're excellent providers. And so you got, you know, most of the health centers are now drawing a significant middle class population into it. So it's one of those things. It's kind of like, you know, Medicare, right? You know, remember the famous sign during, I think it was, I can't remember which presidential campaign, but somebody in New Hampshire held up a sign, "Keep your government hands off my Medicare," you know, which of course everyone laughed at because of course Medicare is a government program. But we have health centers that are supported by government dollars that provide excellent care, and a lot of people think they're group practices. But in fact what they are government subsidized programs that just happen to have evolved into excellent providers of care.
One of the interesting things about Medicaid is that it's not just a program for poor people, but it's a program for people who have disabilities, talking about long-term care for the elderly. I mean, I think those two combined, I think that's what, something like half of all the money in Medicaid.
40% of the state budget is Medicaid. A lot of that is nursing home. So if you wind up in a nursing home, the first thing that happens is your assets go. So you have a house. Well, you don't have a house anymore. The money goes towards it, and when they run out of money and you become impoverished, then Medicaid picks up. But most nursing homes are 70% Medicaid. So a lot of people run out of money because it's very expensive. I think the average nursing home expenditure is about $150,000 a year now. So you can run out of your money very, very quickly. But importantly, it's low-income people that benefit from Medicaid and its primary care services primarily, because Medicaid is for young people and their children. So it's most of the children in Massachusetts. I think close to half of the children in Massachusetts are on Medicaid. So it becomes extremely important that that be preserved. But somehow we get this idea that, oh, these are poor people, and if they weren't poor, they wouldn't have this problem. Well, if we didn't have an economy that didn't provide health insurance to people who are poor and work in menial jobs, then we would have more of an insurance system for low-income people. But we don't have that. So the government for years and years now has had to subsidize low-income people to be able to get basic things like health care. That goes away, we're in deep trouble, because it's not the middle class that is the cost structure, the difficult thing, because they'll figure out some way of getting health insurance. Low-income people will not figure out a way of getting health insurance. It's responsibility of government, because it isn't the responsibility, apparently, in our country, of businesses to be able to provide that. It's one of the reasons why I think Charlie Baker is right on target, talking about finding businesses that fail to provide health insurance. When you have a system of care like the one we have, then it's responsibility of businesses to provide health insurance for people that work for them, in the same way that if you have an individual mandate, you should have a business mandate to match up with it. If we don't have that kind of system, then we have to have government providing the care that's necessary for low-income people, or we wind up in deep trouble where we wind up with patients going to emergency rooms too late, and not only getting poor health as a result, but also costing the system a bundle of money.
Thank you very much for being with us.
My pleasure.
Bill Walczak from the South End Community Health Center. In a moment, progress in charter schools on getting students to the finish line.